Hello, it's Friday, October 29th, 2021. This is Dr. Rhonda Johnson, and today I'm going to be talking about mandatory COVID-19 vaccination for employment. Now, first, I have a disclaimer, folks. I am not a lawyer. My message today will include some medical facts, and it'll also include my opinion. And I'll tell you when I'm speaking my opinion and when I'm speaking medical facts. I want to say that I know everyone's not going to agree with me, and that's okay. You can feel free to leave me a comment. Trust me, I'm used to it. So here are some facts. Federal employees face a COVID-19 vaccination deadline of November 22nd. Federal contractors have a December 8th deadline. I know some states are suing the federal government over this, but as of today, this is the requirement. Now, employers with over 100 employees are supposed to ensure that their workers are fully vaccinated or undergo testing on a regular, at least one time per week basis to help stop the spread of COVID-19 in the workplace. That is President Biden's executive order that came out over the summer. Now, the American with Disabilities Act, the ADA, prohibits an employer from requiring an employee to be vaccinated if he or she has a disability that prevents a COVID-19 vaccination, unless the employee poses a direct threat in the workplace and no reasonable accommodation can be offered. Now, that's all legal stuff, which, again, I'm not a lawyer. But let's say, here's the medical. You are an employee that hasn't been fully vaccinated, and you have a known history of life-threatening allergies to a vaccine component, or you have a history of having a severe allergic reaction to one of your COVID-19 vaccine doses. You would likely be exempt from that vaccine requirement under the American Disabilities Act. Now, that's the last of the legalese that I'm going to discuss. Now, we have seen that employers, schools, stores, restaurants, entertainment venues, or individuals can ask us if we are vaccinated, and also they can require proof of vaccination. So, this message is really for those unvaccinated people out there who are facing this decision. Do I get the shot or do I lose my job? So if you know someone, please share this video message, because I'm really speaking to this group of people. Now, my opinion is I wish the healthcare community, which I'm a part of, had done a better job of communicating the benefits of COVID-19 vaccination so that you would have voluntarily taken the shot. But here's the facts. To date, there have been over 400 million shots in the arms of Americans in the 9 months since President Biden took office. The CDC says the hospitalization rate among unvaccinated adults is 12 times higher than those who are vaccinated. 12 times. Now, we know that vaccinated individuals can still get infected. Again, I know this personally because I was one of those breakthrough COVID cases. And we have seen this increase in breakthrough infections with the extremely contagious Delta variant. Vaccinated people can still transmit this Delta variant virus even to their vaccinated family members. Our real-world experience that is being supported by data and science show that vaccination alone is not enough to prevent people from being infected with the Delta variant and spreading it in household settings. Those were the facts. So my opinion is, if the Delta variant can be spread in household settings, it can probably be spread in workplace settings. But again, so much depends on airflow and ventilation and whether people are wearing their mask and physical distancing and washing their hands. those other non-vaccine prevention strategies. So the question is to people who are unvaccinated facing one of these dates, November 22nd or December 8th, do you lose your job? Or in some cases, your benefits, such as health and dental insurance, income for your family? Well, that's a personal decision that you have to make that, is yours. But I want to give you some medical facts too. I want you to know this because there's so much misinformation out there about these vaccines. So here are the medical facts. The 3 COVID vaccines authorized in the United States do not change or interact with your DNA in any way. All COVID-19 vaccines are free from metals. Getting a COVID vaccine will not make you magnetic. They can't beam you up, Scotty, to the unknown world. COVID-19 vaccines do not contain microchips. What vaccines do is they fight against diseases. They're not tracking your movement. They're stimulating your immune system to make antibodies, just like it would if you were exposed to the natural infection. Yes, it is safe for you to get a COVID-19 vaccine if you plan on having a baby today or tomorrow or in the distant future. It is safe for you to get a COVID-19 vaccine even if you're pregnant or breastfeeding. Currently, no evidence shows that any vaccines, including the COVID-19 vaccines, cause fertility problems in men or women. Another fact, COVID vaccines do not cause vaccine shedding. You hear a lot about that in these myths videos where the vaccine is being shed and, goes into other people and goes into the air. You don't shed the spike protein from the vaccine, but you shed a lot of COVID-19 spike protein if you get infected with the Delta variant or these other variants. A fact, COVID-19 vaccine does not affect your menstrual cycle. A fact, you cannot get COVID-19 from any other vaccines. So if you have to make that decision to get vaccinated, at least you have some reassurance around the facts of the vaccines. Now, here's my opinion, and I've said this before. I am personally opposed to vaccine mandates. I wish people could just get the vaccine because they want to, because they recognize the safety benefits of the vaccine, and they want the vaccine protection to help them live through this pandemic. But folks, if you have to work, it is what it is. You have to make a choice. I have worked in healthcare settings for most of my working life, and getting vaccinated to protect patients against my diseases and to protect myself against their diseases is something I am used to doing. Now, some people don't have to work. It's optional, so they'll choose not to get vaccinated. For others, you might not have a choice. You only know what your situation is. But the benefits of getting COVID-19 vaccine include that you are far less likely to die if you get COVID. You might get sick, but you are significantly less likely to die. Most people have no idea who gives them COVID unless it's a household transmission. And folks, we still have 65,000 new people who got infected yesterday and over 1,000 people who died yesterday here in this country. The pandemic isn't over, and we have no idea what's going to happen this winter, and we have 3 holidays coming up. The effects of the pandemic are enormous. They've been financial, emotional, supply chain, economic, political, and for me, the most crushing thing is that over 155,000 kids have lost their parents or primary caregiver. And most of these orphan children are black and brown. So moms, dads, uncles, grandparents, whatever your title is, if you have to get the vaccine to keep your job, you may also just be getting a benefit of not dying from COVID, something your loved ones may appreciate. That's my message today. As always, my views are my own. Stay safe, prevent COVID, and have a blessed day.